Welcome to the Plant-Free MD podcast with Dr. AnthonyChaffee, where we discuss diet and nutrition and how this affects health and chronic disease, and show you how you can use this to optimize your health and happiness, both mentally and physically. Hey guys, just want to take a second to thank our sponsor, Carnivore Bar. I don't promote many products because honestly, all you need to be healthy is to just eat meat. But for those times that you're out hiking, road tripping, or stuck at work and you want a nutritious snack that is just meat, fat, and salt if you want it, the Carnivore Bar is a great option. So I like this product not because it's just pure meat, but also because I want the carnivore market to thrive as well. And the more we support meat-only products, the more meat-only products there will be available in the mainstream. So if this sounds like something you'd like to get behind, check it out using my discount code Anthony to get 10% off, which also applies to subscriptions, giving you 25% off total. All right, thanks guys. Hello everyone, this is Dr. AnthonyChaffee. I'm here with a special guest, Dr. Sabrina Solt, who is a naturopathic doctor who has recently come across carnivore diet and keto diet and incorporating diet and nutrition into her practice, getting people better. Dr. Solt, thank you so much for joining us.
Thank you, Dr. Chaffee. I'm so happy to be here.
Yeah. Well, can you tell us a little bit about you, your background, and your current practice, and what you do?
Yeah, so I'm a naturopathic medical doctor. I'm currently located in Scottsdale, Arizona, born and raised in Canada. I've been here since about 2011. And I have been practicing in my field for, almost 10 years or so. And recently, like you suggested, I have been introduced to the carnivore diet. And, I was originally I heard about this stuff on podcasts before, and I honestly so brushed it under the rug initially because the brainwashing runs deep when you come from the naturopathic medical side, right? A lot of vegetables are pushed. I'm thinking to myself when I'm learning about this, how could this possibly be true? It goes against everything that I was ever taught. It goes against the paradigm that I exist in as an ND. And so again, kind of left it alone. And then fast forward, months later, my husband he had a few things that occurred in his life that kind of sparked just this search for something else. And it was actually a lot of your videos that he came across initially that really jumped him down this path.
That's
so, if people, might know my husband or, he's hardcore. He's pretty extreme. Like if he's going to do something, like he's going to do it and he's going to do it well and he's going to do it straight. So your approach, which was meat, salt, water, was like the most extreme person could do. Right. So he dove right in and I'm like, oh my gosh, you have to be insane.
Yeah.
I thought it was great. Now I'm thinking it's great. But initially I thought that it was completely insane, just bonkers. And I'm like, you're going to make yourself sick. You're going to feel terrible. And then he didn't. And then his eyes were the whitest that I had ever seen them. His skin actually was no longer dry. It was like this dewy, beautiful skin. And I'm like, okay, there has to be something here. So I call this my descent into carnivore because I had to really take these baby steps to allow myself to unlearn. And this was important for me because I have a history of eating disorders. So to be able to do this in a way that wasn't going to bring up and trigger past things for me was super, super important. So first thing that I did was I cut out raw vegetables. I cut out salads. I used to eat a salad for lunch every single day. I think about it now and I think of like, I was bonkers, just completely insane. Once I did that, I dropped almost 10 pounds, like nothing, right? I went from about 120 pounds, which still wasn't heavy for my frame, but went down to about 110 pounds. And I could finally see, I could never see this before, the line between my lower abs. I had always had like that little pooch there, right? Even before kids. And I have 2 kids. This is post 2 children that I can see all this now, which is insane to me. So after that, I was like, okay, there has to be something to this. And then it just kind of spiraled from there. And thank God, I have Zach supporting me through this and making me steaks all the time and making sure that I'm fed. And I was able to get to the point where, I've gone full carnivore, right? I have not had any meaningful degree of like plants or anything like that. And I don't even know how long, but it did take me a minute to get here.
Yeah. That's the funny thing is that, when you drop salads, all of a sudden you lose weight and you get slimmer. But it's like, and that's the thing that everyone says. It's like, you got to eat salads to get skinny. And, and there's like almost no calories in it. But there are things in there that disrupt your body's biomechanics on how you function and process energy.
Right. And so it's funny because if I think about my practice, the women that are coming to me for their hormones and weight loss issues and all of that good stuff, it's always the middle-aged women that are overweight that are eating a bunch of salads.
Yeah.
It's like, what's the cause and effect here, right? And then they look at you like you have three heads when you say, well, stop eating vegetables. Like, how are you a doctor?
Yeah. Yeah. Well, yeah, and it does, it goes against everything that we've said in the last, 40, 50 years. And of what doctors say too. I remember, speaking to, most people are usually pretty receptive when I speak to them, or they ask me about this sort of thing and I mention it to them. Almost 99+% of people are mostly just interested. And even if they think it's wildly out there, they'll at least just ask questions, ask very probing questions, but they'll just ask questions, be like, really? Well, what about this? And what about this? And, then you talk to them about it and they become interested. Every now and then you'll have people just lose their minds and just be like, oh, how can you even be, you're not even a doctor. This is just crazy. Blah, 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 blah. Like, and then and then it's not a discussion. Then you just have to shut them down, and, but it's, I have no problem discussing or defending these things because it does go against everything. And so, the burden of proof is on me and us now, and so, it's important for them to ask questions and make sure that we have answers. But it is always funny when some people just look at you like, how is that possible?
Exactly. And the way that I like to at least initially frame the conversation with them too is, if everything that you were doing was working, you wouldn't be in my office. So why not at least entertain the possibility of something new? Give me 90 days. And if you don't see at least a trajectory towards the changes that you're looking for, we can try something else. And then I also have the conversation with them too, that if we are what we eat, and what we eat determines our health, and we're only as healthy as the things that we can absorb, and your body is in an unhealthy state, you've actually lost the privilege of eating whatever you want.
Yeah. And, and that's what I sort of tell people, I just say, it's like, yeah, this goes against everything that we've been teaching for 40 years, but everything we've been teaching for 40 years has gotten people fat and sick. So obviously it's wrong, and we need to look at something else. And that seems to resonate with people. They go, yeah, you know what, that's right. And, that the recommendations aren't working. So obviously maybe we need to look at the recommendations. And I always like the you are what you eat thing too, because I'm pretty sure I'm not made out of broccoli or cellulose. And so, and if you want to break it down to something as simple as that, we are meat, you should eat meat. Pretty simple.
Yes.
Yeah.
Yes. And the saturated fat thing, right? Our nerves, everything that holds us together, it's our brain, right? It's all those basic things. And you make a funny comment about the cellulose. And this is a part that actually was almost like a red pill for me, almost a literal red pill, in the sense that every time we prescribe a supplement, it's usually a veggie cap. So how much are we taking? Maybe 2 steps forward, 1.5 steps back, or you know what I'm saying? And then you have these certain influencers online that, tell you they take 300 supplements a day, or, it's just like, how much cellulose do you really, how much of that veggie cap do you really need? And what is that doing in addition to the things that you're taking? So that was a moment for me where I'm like, oh, shoot, we need to back this up. And, I will admit, my patients will agree with this, in the sense that I'm very much a minimalist when it comes to what I'm going to tell you to take. And it might be things like minerals, for example, or electrolytes, or maybe we need to, reset your circadian rhythm with some melatonin short term, but I will usually try to do it outside of a pill method, like liquids, powders, whatever. And again, short-term use, I'm all about, maybe we do this strategically to get you to a point, but the ultimate goal is that we don't have you dependent on anything, right? Like, I want to put myself out of business. My goal is that you don't need me.
Yeah. I think that's a great approach. And I certainly share it. I want people to be healthy and not have a problem and come in. And it's funny sometimes, like, we'll say that we'll have a good rapport with a patient, and we'll say like, all right, it was lovely, but I really hope I never see you again. I'm like,
yes.
Yeah. And that's the way it should be. Yeah. I find that, everything's sort of changed in the last, decade or two. That, like, every capsule or pill, they want to be able to pitch to the vegan market or the vegetarian market, say, oh, it's, vegan friendly, or, vegan gel cap or veggie gel cap, something like that. It's like, can we just get something with gelatin? Can we just go back to gelatin? And, like, I don't even know how to look that up. There's no market for it. So you can't, like, look up, animal-based pills or anything like that. If you want to like have something to prescribe for people, because sometimes like you say, if you want to prescribe something like short-term melatonin or hormones or DHEA or something like that, the capsules that they have are always plant-based. Yeah.
Exactly. And the gelatin thing. So it was obviously just 4th of July weekend, and we went camping with the kids. And, as much as we are carnivore and we're trying to really do that, we don't really necessarily want to deprive them of like the childhood things of maybe having a marshmallow over a fire. But do you know how hard I looked to try to find real marshmallows that were made with gelatin instead of high fructose corn syrup?
Oh.
They're basically non-existent. I remember that being the thing when I was a kid, and I'm like, man, am I going to have to learn how to make real gelatin marshmallows so that my kids can have these moments just, very periodically, right? But 4th of July seemed to be the time that would have been appropriate. And it was so hard. It was very difficult to find. But then of course the veggie caps for even things like organ capsules, I don't necessarily prescribe those a lot, but I know personally I take maybe 1 or 2 every other day or so, because I feel like they give me a boost of energy, and I still have a baby that I'm nursing. So some nights I don't sleep all the way through. If I need a burst of energy, they really kind of pick up the slack for me just from that little bit of loss of sleep.
Yeah, that is funny. Like an organ meat gel cap will not be gel. It'll be the veggie cap. That's funny. So coming from a naturopathic perspective, obviously this is something that is generally thought that the plants are the savior of humanity, and they really push like a vegan or even vegetarian diet, certainly. And then obviously the pharmaceutical approach would be more in herbal remedies, and like instead of prescribing digitalis, giving foxglove, right? That is where we derive digitalis from. What are your views now that on plants? Has that changed since coming around to the carnivore?
Sort of. So in ND school, we had a ton of education on herbal medicine. I joke that it was my potions class, if you're a Harry Potter fan. But just, because we actually did, activities where we would go and gather plants and make our own tinctures and do our own, it was pretty cool. Like we got to do a lot of hands-on stuff, which was neat. If we ever in, post-apocalyptic world, there's that skill set, right? But either way, it made me realize that, you're going through all of these things, and it's like, hey, this is the pharmacology of the constituent that's in it. It's an alkaloid or whatever it is. This is how it gets processed by the liver. This is what the max dosing is before it's, poisonous to the body. These are what some of the side effects can be. This is, the max that you would use in a kid. This is the type that you have to dose by kilogram, on and on and on and on through all of these different plant compounds, like literally probably hundreds of them, right? Yeah. And so you think to yourself, some of them were even things like avena sativa, which is oats, right? So I'm thinking, okay, oats, something that people are eating every single day for breakfast, has medicinal properties. And when you're going through the naturopathic program, you think, oh my gosh, this is so cool. Everything's got medicinal properties, but is that actually a good thing? Can there be too much of a quote unquote good thing? Is there too much of augmenting your physiology in a certain way? And I think that this is where the privilege comes of being a provider, is that yes, we have the privilege of people trusting us enough for us to go ahead and augment their physiology to reach a certain goal. But are we doing that ultimately intelligently? Or are we doing that in a way that could be potentially harmful, knowing that our first oath is to first do no harm, right? Yeah. So my stance on that has dramatically changed, because now the understanding then becomes that every single plant in the plant kingdom has a medicinal property to it, and they're not always for our best interest. And it is slightly arrogant to think that oh my gosh, everything in this world is for for our best good. It really isn't.
Yeah. No. Yeah. I mean, and that's something that I think often is like, we're not in the Garden of Eden. Everything isn't just put here specifically for us to eat necessarily. Everything works in symbiosis at all levels, but that doesn't mean that we're supposed to eat absolutely every plant that exists. And as I've said many times, plants get to defend themselves just like other living organisms, and that's one of their main defenses is making these defense chemicals and poisons. And of course, these can be used medicinally. But what is a medicine? Medicine is just a poison that does more good than harm under certain circumstances. But if you're not in those circumstances, it's doing more harm than good. And so, you have people say that, like, Like garlic has, antimicrobial effects and, can be, antibiotic effects. And it's just like, okay, great. I mean, do you have an infection though? Do you have
Yes.
pneummonia? Okay, then why are you taking antibiotics? Like you wouldn't take Augmentin if you didn't have a need for it. That's going to actually probably harm you. People talk about, anti-VEGF in mushrooms. This is something that Dr. Furman, who came up with like the Gomes diet, he, obviously just pushes just a raw food vegan diet at this point, and he does not look healthy. And he talks about how great that is that he's not healthy and he actually can't do push-ups and is frail and weak. Oh, that's a good thing, because I'm not metabolically active and I'm not running my system down. Like, no, you're just dying is what you're doing. And
Wow.
and so when you're sort of looking at mushrooms, have this anti-VEGF property, say, oh, that's good, in fighting cancer. And it's like, great. Do you have cancer? Like, then why are you taking
Yes.
chemo? I
So
mean,
yes, I agree with that. And I'm going to like even go a little bit further with that. So like VEGF, so in my world, which is the regenerative medicine world, we love VEGF because it means angiogenesis, right?
yeah,
It means you can get additional blood flow to an area that requires healing. So when I'm doing something like maybe an amniotic allograft or even PRP, we love that there's VEGF in there in meaningful amounts so that if I'm popping it into your shoulder, we're going to get blood flow to that shoulder and we're going to get some healing, right?
yeah,
And then, I'm not going to give you white willow bark to take down the inflammation or anything like
yeah,
that, or aspirin, right? Because
yeah,
we don't need to, and
yeah.
it just goes, I feel like it just goes on and it just goes so deep.
Yeah, and that's exactly right. VEGF is has real properties and purposes in your body, and obviously, cancer cells can hijack those properties and create a lot of angiogenesis and just to feed the tumor cells. But when you're not in a cancer state, then you're blocking the actual properties that are good, that are normal and natural that your body is actually trying to use properly. And so that could cause harm. And also, it's also cherry picking. Obviously, you're picking sort of
Yes.
this one thing, but there are hundreds of thousands of other compounds in mushrooms and other plants. What do those do for you? Are they all 100% good for you, or at least neutral, so that this one benefit is gives a net positive? Generally, the answer to that is no. And so that's interesting. I think that it'd be interesting to hear what your colleagues in naturopathy have thought about your descent into carnivory.
Yeah. And it's so funny because I'm a weird ND as it is because
Mhm.
I never even really prescribed fish oils. I never even really prescribed probiotics because there was all like, I listen a lot to my gut and to
Mhm.
instincts and to like, oh, maybe this doesn't seem necessarily the right thing to do. And, come to find out, years later, there was good reason for me to not give things like fish oils, good reason for me to not give things like probiotics. And that's not to say that I didn't ever use them. There, certain situations that, might have, but most NDs, those are the first two things that they give you no matter what. And there is also a lot of this reductionist thinking in there when, in the sense that you were saying that, oh, we're going to just isolate the potential of this one molecule, like VEGF, for example, and maybe we're going to ignore all of the other things, right? Like, are we ignoring the like FGF, fibroblast growth factor, or are we, ignoring our matrix metalloproteinases? Like, you cannot isolate one singular thing
Right.
and think that this is just going to happen again in isolation. And this is where NDs like try to say that they differentiate themselves from other doctors in the sense that it's like, oh, we take a holistic whole person approach, but we're still just going to give you some vitamin E to reduce your inflammation. And it's like, really? Like, are we actually doing the right thing here? Or are we just like practicing what we call green allopathy, which
Mm.
is, giving somebody a supplement instead of a medication and then still
Right.
sending on the way and still treating at those surface levels versus actually trying to get them better. And I think that is 100% where this diet comes in, because like we're literally only as healthy as what we can absorb. And that
Mm.
needs to be the things that we're already made out of. Right?
Yeah. Yeah. Yeah, I totally agree. And obviously, meat is extremely bioavailable. That's been shown in every single study ever. And, people say, oh, it's really hard for your body digest meat. And it's like, who told you that exactly? I mean, look at it, was like, oh, we're much more adapted to breaking down plants. I'm like, you can't break down plants. You cannot break down fiber. No vertebrate animal has the enzymes necessary to break down fiber. So you cannot break it down at all. And so they say, well, meat, it'll stack up, and you'll have like, 10 pounds of meat just rotting in your colon for, after like 10 years or something like that. Like, how would that happen? It's a tube, it goes in one direction. And you're telling people just to eat fiber because it doesn't break down and because it gets pushed out. And so wouldn't meat be doing that too? So there's a lot of things that just don't even pass the smell test with these things, but because they've been repeated so many times, it's just, for some reason, people buy them.
So illogical. Um, it cracks me up. So I have to share this moment that I had in my own head one time when I was still in my descent and still like a little bit of the brainwashing was left over. And I was sitting there and I was like, oh, you know what? I'm really not super hungry right now. I could really go for something light. And my body was like, salad. Like, you should definitely eat a light salad right now. And I was like, oh my gosh, it was just the most insane thing to hear myself think that, oh, this is a quote unquote light meal. And I'm like, no way, steak's going to digest way better. I'm going to feel better after doing it. And that now is like a light meal to me, enjoy the steak with some butter on it.
Yeah, absolutely. And that's funny. And yeah, I think that it's easy to see once you're in it, once you get, start doing it and you see how much difference it is and you see how good you feel. Then exactly like you say, like the wool comes off your eyes and you start thinking like, well, actually, tomahawk steak, that is a light meal. I'm just going to just have that and feel great. And, in a salad, light as in, you always talk about light as in, low fat, because that was always the enemy was fat. But in fact, fat's your best friend. And, and certainly if you're in the wild, like, I mean, if you're not eating fat, you're going to die. It was interesting. I was reading some of the sort of the notes from like Lewis and Clark, the original expedition.
Explorers, yeah.
Yeah, going west. Very interesting. And they also talk about how they're eating. Obviously, they're just hunting the whole time, and they had other rations, but they were hunting most of the time and getting animal stores of food. And they talk about how the fat was so important, and the guys who didn't get enough fat, they all died. And so fat was life-saving. And they would give like the leaner bits and the organs, they would give those to their dogs, and they would eat the fattiest bits. Like that's what the humans ate. And the humans just, for whatever reason, we just need more fat than even other carnivores like, wolves or lions. And so that was it. There's like, the ones who weren't getting enough fat, they all died off. And so, knowing that is quite important and empowering, I think, too, because, once you get on this train and you know what's helping you and you feel so much better, you actually have a direction. And there's so many angles, there's so many conversations, so many people like you and I, but many others that are just saying the exact opposite of what we're saying, and they make very compelling cases, and they have big fancy letters after their name, and they've written books and all these sorts of things. And I haven't even written a book, so I mean, who am I? And
me either.
Yeah, exactly. And so it's very, very compelling stuff, and it pulls people over. And so what are they supposed to believe? But if you are getting healthy and you are getting more healthy, especially, I really love talking to people like yourself who sort of came from that plant-based side of things, or even someone who's vegan for a long term period, and then they go carnivore, and it's just like night and day difference, because you're going to have that change from a standard American diet, from getting off the sugars and the processed foods and the polyunsaturated fatty acids, and just getting just a whole food diet. Even if that's a vegetarian diet or vegan diet, you actually should see some improvements anyway. But after a while, it's going to catch up to you. And then seeing someone who's doing that and doing it right and doing this whole food vegan diet, and then going carnivore, and they're like, changed my life, even more than the first change. That is all. I think that's very powerful evidence. And then just people just doing that themselves and going like, look, I do this, I get this result. And that's all there is to it. Your study says that I shouldn't, but I do.
Right. And you bring up such a good point. And I think this is like a really good distinction to make, is that, doctors like other NDs, if they're, going into, no doctor is out there trying to not help you. right? I think everybody's trying to do their best. They might just have different information. And, at least in the world of NDs, naturopathic doctors, is we get people that are coming to us sometimes usually at the start of their health journey. And sometimes, yes, it is enough to get them results, to just get them off the standard American diet, right? And that's why probably some of them think that, oh, veggies are the answer because we give these people vegetables and they get better. Well, okay, was it the vegetables or was it the lack of the PUFAs and all the other crap that they're consuming, the high fructose corn syrup, et cetera, et cetera? But then, why are they still your patients 5 or 10 years later, right? I think, so is it now still the vegetables that could be causing the problems? And is the next graduation of that towards the carnivore diet? And should we really be considering maybe we just start people here? And because honestly, people get once they get over just the shock factor of it, and they're like, wait a second, I can eat a ribeye and I can have bacon and I can put butter on everything. And you actually see a genuine excitement because we like these things. We're ingrained in these things. And I made a somewhat joking Instagram post not too long ago. And it was about the idea that vegetables are like Stockholm syndrome, as just babies, you hate them, you detest them, but like they're forced upon you. You get to love your captors. Eventually you love them and you don't want to get rid of them and you're tied to them. And it's Stockholm syndrome with vegetables.
Yeah, I've made that exact same analogy, and I 100% think it is. Yeah, I was saying, he's like, yeah, you end up loving your captor, and it's like talking to someone in, like a woman in a battered shelter. It's just like, oh, I like it when he hits me. It's like, no, you don't. Stop that. And then people saying, oh no, but I like broccoli. Oh, actually, I like salad. Like, stop it. No, you don't.
No, you don't.
Yeah. And, I talked to some people, early on, we're sort of talking about this, and they're like, and they sort of thought that what I was saying was you don't have to eat salads if you don't want to. And they're like, well, actually, I like salads, so it's not a big deal. I'll just keep it. I was like, no, it's not that you don't have, well, hey, you don't have to. It's that, no, you don't want to. It causes harm, and it's bad for you. And yeah, exactly it. No kids like vegetables. I mean, maybe there's going to be one person out there that's going to, well, actually, my kid or whatever, but I think there's going to be vanishingly rare. Kids are hardwired, just mammals in general, hardwired to pay attention and focus on what their parents are doing and emulate that, because by definition, they have, they've succeeded in the game of life. They've procreated. And so whatever they did, something that allowed them to get to the point of procreation. So you're just hardwired. Okay, I need to study on what this person does. That's why, wolves and foxes and cheetahs, they study their mother and to see, okay, how is this creature hunting? What are they doing? What are their habits? And so they have very, very similar skill sets, passed down from generation to generation. So, we have that as well. And so kids are going to be focused, hyper focused on their parents, and their parents are eating a bunch of vegetables. And they're trying to eat these vegetables. They inherently trust them. And so they're just kind of like, well, okay. And so it fights against everything to not listen to their parents, but it's also fighting against everything to eat this toxic substance when everything in their being is yelling at them, don't eat this. This is poison, spit it out. And so it's very hard for them. And that's why so many kids just get so, beside themselves when eating vegetables, being forced to eat vegetables. I was certainly one of those kids. I hated these things. People talk about, I was like, oh, well, I like broccoli. I don't think anyone likes broccoli. I think they like broccoli because it's the least offensive vegetable out there. But, I would challenge people to think back to when they were kids, and did they actually enjoy broccoli then? Because I certainly did not enjoy broccoli. I hated broccoli.
Well, my question to these people, it then becomes, okay, I'll take my diet, which is animal meat, and you take your diet, which is vegetables, and we go into nature. Yeah. Let's see who will eat their food with no preparation.
Yeah.
I can take down a pretty raw steak, like, slight moo might be coming from it, right? Yeah. So could I probably take down a dinner way more readily than you could eat that broccoli or that wild lettuce or whatever that's growing? Mm-hmm. And then who's going to thrive, right? Yeah. Who's going to actually be functional? Who's actually going to be able to go and get more food after that and come out probably stronger and healthier? And that's the difference. Like it is such a privilege to be alive right now because you can make those bad health choices and still live and then tell people about it on the internet.
Yeah. Yeah, like, and that's the thing too, when you're out in the wild, it's very difficult to identify edible, so-called edible plants.
Yeah.
Most of them will make you very, very sick or kill you in enough
Mhm.
concentration. And so, edible in the sense that they're not going to just kill you that day, but that doesn't mean that they're not doing harm. That doesn't mean that they don't have these defense chemicals. They do. It's just that we have more defenses against those defense chemicals, and we can break them down more readily before they cause fatal harm than other things. But things that we can eat and we eat normally, will kill a dog or a cat, and so they have less protections against these things. But they're still poisonous. They will still kill animals. It's just that some animals have defenses against certain poisons, and so when you get out in the wild, you have to be very careful if you ever want to put a plant in your mouth, because most of them will screw you up. And that was my dad knew this like a special forces guy. I think he was British, and he said, and this guy said that they taught them, and when you're out in survival mode and you get dropped off somewhere and you have to just survive off the land, that cardinal rule is never eat anything that doesn't move,
I
and
like
no
that.
spiders. So it's like, and then it's the same idea. You eat a
Mhm.
spider and it's got a poison sac. You're going to be screwed on that. And so that's it. It's just so anything that doesn't move. So that goes for carrion as well. Some
Mhm.
rotting carcass. You don't want to eat that. Our
Yeah.
ancestors did though.
Mhm.
And a lot of other animals do also. But you're running the risk, and so I would certainly wouldn't recommend that for
Yeah.
anyone to do that. But but you, what does that mean? That means animals. You
Mhm.
have to eat animals, and so if you're surviving in the wild, you eat carnivore. That's it, and you just get back to your roots. And there's so many of these examples that just sort of point back to what we should be eating optimally. And then we go home and we think that salad's great, you know?
It's really silly, and I agree with that. It's you know, and there's even the idea that eating things like raw meat too is still going to be part of our natural diet, or that um, it, that we don't necessarily have to cook things. And did we always cook our meats, and did we always cook our
Mm,
foods, back in the day, whatever that day was? And, to your comment about the explorers earlier, and, preferring the fat and everything like that, like it's so important, I think, to make sure that if you are going to be even eating, again, making choices for the animal meat, that you are eating the full amount that's available to you, including
mm,
all of the fat that's going to be that delicious part and super, super nourishing to us. And forget the salads,
mm.
completely forget the
Yeah.
salads.
Yeah.
Not a thing.
Yeah, definitely. And so obviously, at this point, you're sort of pushing that for your patients as well. What are the results that you're seeing? How are they doing?
Oh my gosh. So it's so fascinating. So I do a lot of procedures for people who have musculoskeletal disorders. And I do basically a type of regenerative ortho stuff with like stem cell based therapies, PRP, things like that. And we have to consider that most joint issues, pending their product from a very severe trauma, all the things that, the osteoarthritis that we get as we get older, stuff like that, has a metabolic tie to it. So really good example I can give actually is, I can't even count the number of times that I've had this presentation. And it's a middle-aged woman who's gotten on a health kick and has started juicing kale and spinach every morning. And now all of her joints hurt. So
Mm,
naturally they're coming to me because she wants all of her joints fixed, right?
right.
And I'm like, well, stop juicing your kale
Mm,
and your spinach and your joint pain's going to go away. I mean, mind you, it's a bad business model for me because, well,
mm,
no procedure in that patient, but did they get better? Absolutely, because there's still this metabolic, there's a metabolic cost on all of your joints, right?
mm,
Because you are what you eat, and you need the fat, and you need the protein, and the amino acids. You need all of these things to create those joints, right? So what I do actually is I do get my patients on, I'm calling it a modified carnivore, because a lot of them are older and they might not be able to go all the way right away. And I'm really big about meeting my patients where they're at. And some is better than perfection to
yeah.
me. Like if we can at least get you eliminating most of the bad stuff, if you're going to have like a piece of fruit here and there because it's going to keep you sane, but it's going to keep you on the rest of it, I'm gonna be okay with it, because it's gonna be better than what you were doing before.
Yeah.
So I will give them all the guidelines. And again, they do what they want. But honestly, the amount of pain reduction that we get before they ever even come in for the procedure is at least 20 to 30% because of that metabolic cost. Like that inflammation that has been plaguing you from what you're intaking is now just gone, right? And I'm actually turning a lot of my stuff into a program, and I actually just finished recording the program yesterday. And my whole diet module is based on carnivore. And it's this idea where, you know, not only am I teaching carnivore, but I have a whole unlearning section, right? The unlearning the fat is bad for us, the unlearning the vegetables are good for us, because before I give you the new information, you need to understand first why this is so bad. I'm teaching that, and with the idea that, again, I want them coming to me so well prepared for this procedure that we're going to get them back their joints like they had 10, 20 years ago, right? We're going to make them juicy and functional again, and they can be active and they can do all of the things that they want. And, you know, I actually get a lot of patients with a disorder called arachnoiditis, which you're probably familiar with. You're a neuro, right? You do. So arachnoiditis, for people that don't know, very severe type of damaging inflammatory disorder of the layer around the spinal cord called the arachnoid layer. And a lot of times there can be this adhesiveness that happens with those nerves and this bundling of these nerves. And usually it's in the lower part of the spine, but I have seen patients with it in other regions as well. But it produces a whole host of terrible symptoms. Some people lose the ability to walk, they lose their bowel function, urine function, sexual function. Of course, the pain in their legs, the burning, the electrical pain, all that nerve type pain. I do a lot of stem cell therapy for this because we actually can get those nerves to heal and regenerate. And it's been phenomenal. But with the diet stuff, getting them to eat saturated fat, again, giving them more of that building block for those nerves to heal, it's next level. Like it is just so much more of an improvement because, again, the body is always going to rebuild with the tools that you give it. If you give it dysfunctional tools, it's going to build a dysfunctional product. If you give it great tools, it's going to do even better. And, you know, I do a lot of the comparison of like, when we're talking about regenerative medicine, we can akin it to like building a house, right? You have to have the right tools, you have to have the right workers, you have to have good timing, you have to give it time to happen, and things are going to happen in stages, right? And part of the right tools is the diet, what you're putting in. So I'm always big on the minerals, big on the fat, big on the protein.
Yeah, that's really interesting that, you know, it can help with you know, cord tethering as well. You know, usually when we get involved, this is such a problem that we need to actually go in there and divide the scar tissue and the arachnoid layers and try to unbundle these. But yeah, it's a nasty condition to have, and that's great. So do you inject stem cells on, you know, around the cord, or like as you through the dura, or
I'll tell you. Yeah, I'll tell you my approach. So I actually specialize in taking people's fat cells, people's stem cells from their own fat. So we do a minor liposuction procedure. We harvest the stem cells. And I do two types of processing with it. So first type of processing, we basically create like a microfat graft. And this is important because stem cells are really, really sensitive cells. So if you just like pop isolated stem cells into like a really hot and inflamed area, they're just going to apoptose. They're just going to die because they're like, oh, we don't like this. So we do a microfat graft and we're keeping them with their food source. Basically, the studies show, and what I've seen in clinical practice, is that you do get higher colony formation with those. So they're better able to work. And the way that I'm doing my injections, they're all done in ultrasound guidance. We're not actually going into the spinal column with these because we don't want to possibly further injure anything. But I basically do a medial branch approach and facet approach and some paraspinal approach as well. And what this allows the stem cells to do is actually their homing mechanism, right? So if we're putting them, or even if we're doing like a nerve hydrodissection around where the nerve is exiting the canal or at that medial branch, they actually have the ability to basically detect damage and travel. And they do things such as secrete their exosomes across things like the blood-brain barrier into the spinal regions that can help reduce that. And I have seen pre and post MRIs where we do get a reduction in this. We also will put some intravenously, so they're able to go throughout the whole entire body. But I've seen people get out of wheelchairs. I've seen people have their drop foot fully resolved. People who have got their dexterity back in their fingers, they can write again. They can do all sorts of things, sexual function back. They've got their they can defecate on their own. They can urinate on their own. Like it's been really freaking
After like a
cool.
spinal cord injury or like a cauda equina sort of
So
compression?
yeah, every
Yeah.
patient is different. I've
Yeah.
had a lot of women who have had it happen post-epidural. I've had some
Mm.
people have it happen after they've like just random accidents. I had one patient have it happen after a gunshot wound. That was
Mm.
a really interesting one. We actually did his whole spine had a really bad scar going up because of how they had to go in and take the bullet fragments out. They had to
Mhm.
basically open them right up. And we actually did some hydrodissection of the scar itself with some platelet fluoroplasma. And like within weeks, he was able to do a full golf swing, right? He got so much function back. It was
Nice.
fantastic.
Yeah.
Yeah.
And you find that the carnivore diet helps with that as well. So is that's augmenting those treatments?
Yeah. So now whenever patients are enrolling in this stem cell program, they're getting access to these modules, which are teaching them all about carnivore. So they're hopefully going to be adopting this. I tell them at least the 6 months while you're in this healing program, because I want you to get the best results possible. But I ultimately would like this to be your lifestyle at this point, because it's only going to be better for you, right? But at least during the time where we're working together, I need your body to be able to heal the absolute most it can. And, we see these incredible healings just within the carnivore community without them coming to see a provider. So, when you get the combination of the two, we can really work synergistically, and maybe we can do targeted things for hormones or targeted injection therapies or other things like that. I mean, man, we're just going to create this like amazing, not only is the community amazing and strong and smart and everything already, but now we're really recovering people to such a meaningful degree, and just the ripple effect that I think that it has on the world, because now they're showing up as better parents, partners, loved ones, everything in their lives. And it's just, it's really cool the work that we get to do.
That's good. And so do you still incorporate some of like the the herbal prescriptions from naturopathy, or you mostly stick to the hormones and the injections that you're doing now?
I rarely use herbs.
Yeah.
I'll tell you the things that I will give people to supplement. I'll give them a collagen powder or a bone broth powder if I think that, they could use it. I'll do minerals. I'll do electrolytes, because again, those things can imbalance initially when people are getting on this stuff. And that's pretty much it. I might have them do some topical arnica after their procedure, because we're doing a minor liposuction after all. But I really don't do a ton of supplements. I told you I'm a bad ND.
And I think that's good though,
Right.
because like you say, you're trying to get people healthy, and they want. I think some people go to naturopathic medicine practitioner because they want to get away from allopathic medicine. Like I don't want to just go to someone who's just going to prescribe me a bunch of drugs, and then they go somewhere and they prescribe them a bunch of
Supplements.
plants and flowers. And it's just like and I've seen some people naturopaths say, oh yeah, we don't prescribe all these drugs and this, that, and the other, but they are always just stuffing supplements out the door with them. I was like, how is that not the same thing? And so, and I obviously like to stay away from supplements as much as possible, because certainly for nutritional standpoints, but there are people that when you get older, it can become more difficult to absorb certain nutrients, and sometimes people just have need a bit of help, and so I don't really like the idea of supplementing unless you have a clear clinically diagnosed deficiency in something. So but obviously there is a role for that in those cases. So when so what is the main part of your practice now? Is mostly the injections, or
Yep. Mostly regenerative medicine. I have done a lot of like anti-aging hormone stuff in the past. I actually closed my practice down to new patients for that until at least September, just because we were really, really busy. And I can only see so many people, but we should be open back up for new patients for that in September. And I love doing hormones for patients, because ultimately, hormones are kind of our master signalers in our body, and they're responsible for so many things. And, women go through menopause, men have a degree of andropause. And, just because that hormone production declines doesn't mean that those processes in the body that required hormones all of a sudden stop, right? Women go through menopause, and estrogen does like 500 things in the body, and their estrogen production tanks as soon as they hit that, but they might still have another 40 years left of their life. You mean to tell me that they're going to live that many decades without those things happening in their system. I just don't think that that's fair. So I think that, properly prescribed bioidentical hormones can allow people to live a higher quality life. And it's definitely something that I enjoy working with patients with, and they get to see, again, great results, but the diet has to play into that as well.
Yeah, no, I totally agree. Even with just, the hormonal side of things, you do find that when people go on a carnivore diet, just, optimizing their nutrition, their body works better, their hormones work better.
Yes.
Even just the simple fact that you're increasing cholesterol, you're going to actually make hormones, because that's what, hormones are made out of, is cholesterol. And then you're reducing your insulin, which actually is very beneficial for a number of reasons, but specifically in women hormonally, insulin, just high insulin levels can block the conversion of testosterone into estrogen in the ovaries. And so, you're going to have less estrogen, you're going to have more testosterone. This is a major culprit in things like PCOS. Yeah, exactly. And so, which is the number one cause of infertility in women, and causes all sorts of other problems. Infertility is only one of them. They'll have a lot of serious medical issues, and not feel good physically or mentally, put on weight, grow body hair, facial hair, and not really be happy in general. So it's there's a lot going on there just from diet. They can just completely rearrange your hormones, and obviously the hormonal mimickers and disruptors in plants that can really screw with you. It just makes so much difference. And then Ken Berry, Dr. Ken Berry, talks about how,
I like it. Yeah.
oh yeah, I love Ken Berry. He said that when he first started getting onto paleo keto sort of approach, and putting his patients on this years ago, they he had patients that were like in their mid 50s, hadn't had a cycle in 5 years, and all of a sudden they were coming back, and some of them were just getting pregnant. They didn't even get their period. They just all of a sudden got pregnant because they weren't expecting to have to need to use precautions. So all of a sudden it was just bam, they're pregnant. I'm like, what the hell did you do to me? And they were all angry at first, and he said that after that they actually became quite grateful that they were able to conceive. But that, first of all, it has to be a big shock to anyone who's in that position, and can be quite disrupting. But it's also, it's a sign of your health is dramatically improving, and and that's just a testament to that. And then I agree. I know practitioners and that have been in the functional medicine world and bariatric medicine for decades, and they find that putting people on bioidentical hormones at physiological levels, which is always the key there. You're not pumping someone full of roids.
Right.
You're just getting them up to a physiological level. That this actually has confers very serious health benefits. I don't think if someone wants to go down that path, I think it's fine, but I always recommend that they go carnivore for at least 3 months, 3 to 6 months, and then see what your hormones are at that point, and see how you feel. And if you're still deficient and you feel that you need something, then that's something to consider and discuss with a doctor. But you'll already get a huge amount of benefit, just from the diet itself. I certainly feel fantastic. I know, Dr. Baker, he's, in his mid 50s, dude's jacked. He just works out all the time. That's another thing too, is that heavy resistance training that will increase your testosterone, that will increase your testosterone receptors, that will increase your growth hormone production as well. And so you might not need anything at that point.
I agree, especially for men. So the man picture, we talked about kind of a female picture that I see a lot, but the man picture that I see a lot is this guy. I get a lot of guys that come to me for ED issues, and love helping them with it, because it's like the coolest transformation once you actually get them to the other side of it. It's just like a brand new person is there. But the picture that I see is they've had ED that has been slowly progressive for many years. And it started after their doctor found that their cholesterol was elevated and their blood pressure was slightly up. And now they're on a cholesterol lowering medication and blood pressure lowering medication. And they're eating more vegetables because their doctor said that they needed to. And I'm like, okay, well, the good news is this is going to be easy, right?
Yeah.
Like the good news
Yeah.
is we're going to get you the results that you're looking for, but we have to have a really deep conversation first, as far as, well, why did you get here? And, trying to, like, a lot of them are very, very happy to get off the cholesterol medications, because many of them feel terrible once they take them. They're like, all of a sudden my cognition is gone. My joints hurt all the time. I'm like, well, yeah, because cholesterol is essential. It's an essential thing that you actually need. You don't want to lower it, right? It is the beginning it's the beginning of molecule of all of your hormones, right? We need it to heal. We need it for our brain. Good example is pregnancy brain. Okay. This brain fog that we get when they're pregnant. Well, that's your cholesterol tanking because you're building a nervous system, right? You need to eat more fat. Like, it is 100% a cholesterol deficiency having that. I will take that to the grave. But anyway, the guys, it becomes so much easier to treat the ED when we talk about, well, okay, we're going to eliminate all of these things. And that's going to now heal up these factors that caused it in the first place, which is the lack of testosterone, the damage to your blood flow, and also just the agitation of your nervous system, right? You can't actually get the proper nerve conduction there because, well, things just aren't working as well as they should be. Maybe your myelin isn't even as nice as it should be because you're reducing all this cholesterol. You can't actually heal and repair. And truthfully, we need all three of those ingredients for a healthy erection. You need the hormones, you need the blood flow, you need the nerve conduction. Once we correct all of these, which usually doesn't need to take a long time, maybe 3 to 6 months, because we simply, still have the healing timeline ahead of us. But you can get full resolution without having to have a surgery, without having to have a penis pump, without having to spiral down on the Viagra, Cialis, trimix trail for years, which aren't even actually helping you. They're not getting to the root of the problem. They're just covering it up. And they only do that for so long before your physiology eventually craps out, right? But we can fix it.
Yeah. Well, and yeah, that's got to be very, very rewarding as well. And like, anytime you're helping a guy, get that back, I'm sure that they're just going to be your biggest fan. Just a funny anecdote with that about Viagra, when that first came out, hit the market. Apparently, like in pilots, there was a big disruption in routes and things like that pilots were taking, because it all goes on seniority. Like, you have more hours, you get to pick your routes as a pilot and a captain. And so all of a sudden, all these older pilots that had, all this just tens of thousands of miles more than anyone else, they were coming out of retirement and they were taking all like the big, like New York to Brazil sort of trips, because like now they had Viagra, and now they're just going to all these like hot spots that had like, beautiful women. And I just thought that was absolutely hilarious that like enough people, came out of retirement simply to like, Brazil was like the main one, but a lot of these like major places in South America, and they just took over those routes. Like no other captain was getting those routes, because all these guys came out of retirement just to get those routes. I thought that was absolutely hilarious.
Listen, I mean, I really do think that ED is the silent epidemic right now. And, there's roughly 30 million men just in the United States that have some degree of ED. And it's like, it goes up by age group, right? So 50% of men in their 50s, 60% of men in their 60s. And, not only does it mean that their underlying health is affected, because clearly it has to be, right? And pending, a very severe trauma or something to the area, because that still does happen. But if you have just, garden variety ED, it's because your health is tanked. And this is, I don't know if you're in our carnivore group you are in our carnivore group, but it's called Harder, Happier, Healthier, because that's our brand. Because my ultimate goal is to actually help guys with ED, because my goal is to actually reestablish strong, healthy men in the world, because I think that that's what we're seriously lacking. Like, if we want to get to root cause of why the world is sick, it's because we need more strong, healthy, truly masculine men actually stepping into that and embodying that. And, luckily we have, people like you and my husband and Dr. Baker and Dr. Barry, who are like exemplifying this, as great role models for other guys to see, and knowing that, hey, there is this part of, society where you can be naturally healthy, where you can be a strong masculine man, where you can put this, picture out to the world, and it's readily accepted and, celebrated too.
Yeah, absolutely. Yeah, that's one thing. I was talking to Professor Ben Bickman from BYU on my channel, and he was saying that pointing out that ED was one of the first signs of of atherosclerosis and
Mhm.
also of non-compliance of our arteries, because that's one of the things that gets affected first, and we certainly see that first. That's something that's a noticeable result that people say, hey, something's going on here. And so that's generally like an early warning sign. Like that's the canary in the coal mine, that there's
Mhm.
more systemic damage happening. There's a systemic process going on that is going to continue to batter and worsen your health. And so it has the same sort of fix. You stop doing those things that are causing that, and then your body can heal. Usually it heals quite well, if not all the way, but it's at least going to get better than it is, and it's going to stop getting worse.
Right. And I think it's that the broader idea there being that the body wants to heal. Like our
Mhm.
bodies want to be in a state of health. And when we get these things like cholesterol laying down in arteries or bone spurs forming, that's actually the body's intelligent response to some sort of damage that it just like didn't do quite right, because it's trying to fix something and maybe it just isn't doing it correctly. But ultimately, the thing being is that, yes, the body is trying to be healthy. If something goes wrong, it's likely an intelligent response, and we should be working with the body, not against it, to try to help it get there. And you can heal. When I talk to patients about regenerative medicine, I'm like, if you're breathing, you can heal. Like if you're
Mm.
above ground, you can heal because you're doing it right now. If we didn't have active stem cells running through our system, we'd all be done in a couple hours. Like
Mm.
it's that simple. So if you're here, if you're functioning, if you're alive, your body can heal. You're never too far gone. I truthfully don't believe that
Yeah.
ever.
Yeah. And, some people say, well, I'm 74. Is it really too late for me? And, I just tell them, like, it's never too late to stop eating poison, you know?
There you go.
And so,
Boom.
yeah. So, and that resonates with them. My grandmother, unfortunately, was given very bad advice when she was I think she was in her 50s, and, she was in Spain at the time. And she spoke to a doctor there and said, okay, she'd been smoking since she was 13. This was a way of sort of thumbing her noses at the Catholic nuns that were running the school that she went to. She went to like a Catholic boarding school.
Mhm.
And, so she'd been smoking since she was 13. And in her 50s, she said, well, should I really stop this? And he said, you know what? Damage is done. Just enjoy yourself. And I was like, why would you do that? You know?
Malpractice.
Yeah, absolutely. And,
Blatant.
and so unfortunately she kept smoking, and, for another 20 years, and got, extremely bad emphysema, and had a heart attack, was in the hospital for, a month or more, and, thankfully survived, and, lived another, 20 years. But it was, it was obviously the wrong call for that
Yeah,
doctor to say, like, oh yeah, but no, damage is done. Well, more damage can be done, and you're
always.
and you're also stopping yourself from healing from all the damage that you did to yourself.
Yeah, I'm completely with you on that. That is terrible advice.
Mm.
I honestly like. I wish I would have started cataloging this earlier in my career. Just the things that patients have told me that other doctors told them that are just so disempowering, so incorrect,
Yeah.
so just out of this world. Like,
Mm.
patients that are like, I don't know, I don't even want to get into it, but I'm sure you've had the same experience where
Mm.
it's just like, how in the world does this person have a license?
Mm.
You know?
Well, I got really upset the other day, well, maybe a few weeks ago, when a patient told me that, she had a primary brain tumor, brain cancer,
Mhm.
and it was very aggressive. It's very, GBM, very, very aggressive. And she was talking to, someone in oncology, and they said that, so, well, what can I do something? Can I do this? Should I worry about what I eat? Should I worry about exercise, this and the other? And they just said, you know what, at this point, it really doesn't matter what you do. You're on borrowed time. And so, just do whatever you want. I'm sure that they were trying to do that as like a, just go enjoy your life, just get out, just don't worry about, being healthy, just enjoy yourself while you can. I'm sure that's what they meant by that, but it was so deflating and defeating to that patient, because they just felt completely helpless. They're like, I'm going to die. I have no control over it. Nothing I do matters. And it's just like, I'm just at the whim of the universe. And, I told him, I was just like, that's completely wrong. I disagree with that entirely. You absolutely have control in this. You absolutely have a say in this. What you do does matter. What you do matters to your body and to your health and to this course of this disease. And it also matters to the people around you and to your family and the legacy you're going to leave behind you. So absolutely everything you does matters. And you do have a say in how this goes. So yeah, and you could see them like literally their eyes are sort of like their heads are sort of picking up. They brightened up, as I was
Mhm.
talking to them. And I think it's very important for people going through any health issue to feel that they have a say in this and that they're playing an active role in it, as opposed to just like, oh, I have this problem, I go to this doctor, I get this pill, and it's out of my control. No, it's absolutely in your control. It's
Yes.
and more visibly now than ever before, because most of these problems are just caused by eating crap. And so, if
Yeah.
you can absolutely just change the course of your entire life by, changing what you eat and your diet and lifestyle. And so it's really only them that can do
Mhm.
it. I can't eat those steaks for them. I'll share,
I
but
mean, yeah.
yeah, but they have to do it. They have to put in the work, and it's them doing it, and so some people don't want to do the work, and they'll get the results that they get, but a lot of people do want something that they can do. And I have so many patients to say, especially the ones suffering from cancer, they say, is there anything I can do? What can I do to help this? You have the chemo and you have the radiation, but what can I do? What can I do to help this? And most people say like, oh yeah, there's really nothing you can do, or just make sure you get to the appointments on time or whatever. And I always tell them, it's just like, look, just be the healthiest individual that you can be, and the healthier you are, the better you're going to weather these treatments, and the better that your body is going to be able to fight this cancer. And and so and I'll talk to them about what that means, because they always ask me, okay, well, what does that mean? What should I be eating? What should I be avoiding? And it takes a lot longer in these consultations. But obviously I don't feel that it's ethical to not tell them what I know.
Yes.
And so I have to, go in, so I go into that if they want to hear about it, whether or not it takes more of my time or not, because it's very important. That was actually one of the reasons I started doing these videos, was so that I could just have something to direct people
Have a
to.
bank. Yes.
Yeah, and just say like, okay, well, this is what I'm talking about, and they were like, wait, what? And so they always obviously have tons and tons of questions, and
Mhm.
so now I can just sort of give them a bit of a rundown and just say, here, look, I've set up videos exactly for this. Take a look at that, see what you think. They all have resources. They all have links to other doctors and researchers and papers and studies, and and take a look through them, and just do some homework and see what you think. And if that's something you want to incorporate, then you do that. I don't ever try to push this on anyone, but if they ask about it, I feel that I'm absolutely obligated to tell them about it, because I know it works.
I agree. And I agree with that for sure. Like it's never, I'm always inviting people, right? It's always just an invitation to try it this way. And
Mhm.
you're never held to it. I'm never going to force you to do anything. You're obviously your own sovereign being. And I hate that. And this goes back to the paradigm of medicine too, right? I hate the whole trust me, I'm a doctor thing. Like,
Mhm.
yes, trust me because I'm a doctor, but also like take what I'm saying and go and learn it for yourself, research it for yourself, and pay attention to who you're getting the information from. I posted the other day my recent labs on my social media because I wanted to be like, hey, I think my advice is so good that I'm taking it myself, and here are my results,
Mhm.
right? So it can speak to that. But then you also get to this idea in the paradigm of medicine where you have patients, and I feel like patients come to you in one or two different positions, right? Either they're the victim in their story and they're looking for the doctor to be the hero and to save the day with a pill or a surgery or what have you, right?
Mhm.
And I feel like that's a very disempowering paradigm to be in, but that's what we're used to, right? The
Mhm.
generations that came before us, that's what they had. They didn't have people sharing on social media. They had maybe their local doctor that they went to who did that. They dispensed the medication, and maybe people just didn't get as sick as they do now because we didn't have the crappy food sources.
Mhm.
And so that type of medicine was okay. But now we're not in that paradigm anymore. So a lot of this thinking needs to switch, right? So now I feel like the second type of patient that comes in, which a lot of them are coming to this, is that they actually want to be the hero in their own story. They're not necessarily looking for a hero. They want to be the best hero in their own story. And they're looking for the guide, right? They're looking for somebody that can guide them on the right path, help them make the right decisions so that they, again, can be the hero to their family, to their work, to whatever it is. And I think that we really do need to start, continue to push that type of paradigm of medicine, because that's how we actually create healthy humans, by taking their hand and leading them and inviting them on this journey to be healthy with us, and not just acting as that hero or the savior to them when they're in that victim state.
Yeah. Yeah. And I think that's, people, when they have that mentality where they want to be, an active member in their own, health journey, I guess is a weird new agey way of saying it, but that's probably pretty accurate. But just in their health, they want to be in control of their health, and they want to get better. And I think that those people, will often do better if they get the right advice. Obviously, there's so many people that, do exactly that, and they get told, go vegan, do the Gomes diet, and they get sucked into that. And
they read medical medium.
I've never, I heard that mentioned, but I've never actually come across that. What is that?
He pushes juicing like 4 to 12 stalks of celery every morning.
Gross.
I know. And it's just, it boggles my mind. And people, and like some of the things that, because people will share these things like, oh, what are your thoughts on this? And I just look at it and I'm like, where do I even start? Yeah. Like there's so many things here to break down. And, it's he claims that his information comes from a channeled entity.
Oh, come on.
So zero basis in science, but yet there's these health coaches on social media preaching medical mediums work, and like people are paying big bucks to see these health coaches, right? Not even like physicians, like hundreds or thousands of dollars for these health coaches. Jesus. It's like, it blows my mind. So, we're out here trying to do the absolute best we can, but like, this is what we're up against.
That's actually insane though. I mean, he's saying that he's channeling a spirit that tells him to juice
the medical medium. Yes. That's how he's getting this information. So it's all from this, like, it's completely bonkers. But here's the thing, is that these other people, this is where I think me and you, and Dr. Barry and all these other doctors have a hard time, is because we have medical boards, we have malpractice, we have things that actually like confine us into more of a box than just Joe Schmo on the internet who, might not get sued for, posting X, Y, and Z, right? Like they don't necessarily have the people over them looking at their shoulders or looking at what they're doing to the same degree that we do. They're not held to that standard.
Yeah. That is a bit concerning. I mean, obviously you have to be very careful when you're giving out medical information. You can certainly give out advice and say, this is how I would do it, or this is what I've seen, but specific medical advice is that's actually like the legally protected thing, and you can get into big trouble doing that. And so these guys might be asking for some problems there, because if they're going out giving medical advice, telling people to stop taking this medication or that medication, do this, that, and the other, they could actually face serious charges, especially if someone gets hurt doing that. They could actually face criminal negligence charges or more. I don't know exactly what they would get hit with, but they could be in some serious trouble. The idea that you're going to take advice from some spirit guide who's channeling, I mean, who's he channeling? Just like, like the best doctor in, some galaxy somewhere? Like, I mean, is he channeling aliens or spirits, or like, what the hell is this guy like saying? It's just like, Archangel Gabriel is like channeling through. It's like, no, seriously, celery, guys.
Gotta be celery.
Yeah. And, that's bizarre to me. But so it sounds like they're just sort of a raw food vegan juicing sort of thing.
I haven't dove into it in any meaningful capacity. I've seen just like the stuff that pops through on the social media platforms, but it is very disturbing, because the people that start to believe it, they really do truly think that this is the right thing. And there's like, it's another thing when you have, scientists or other people providing you some sort of evidence that you can like strictly refute. But when all of your evidence is, oh, it was just channeled,
Yeah.
there's no base of logic for you to even say anything against that besides, oh, maybe my higher power said he was sick. Like, where do you
Yeah.
you can't have even a rational conversation to be able to try to switch where their thought process is coming from.
It's very strange too, because like, maybe this guy is fully, fully believes what he's saying.
I'm
Maybe.
surprised you've never come
Yeah.
across him.
No, yeah, God, that's bizarre. No,
You're gonna get
I've
ads
come
for
across
him
the
now.
name. Oh, dude, yeah, that would be awful. Um, you know, but like, maybe this guy, completely believes what he's saying, but if this is, a con, which it really sounds like it is, um, there are laws, protecting these sorts of things. Like, it's like, how do these guys not get prosecuted, or how do they get prosecuted? I guess you may have to, like, prove that they don't believe what the hell they're saying. So it might be difficult, that they're just conning people, but it's, hopefully people aren't, there aren't too many people buying into this, and hopefully that settles down, because that's, just going to hurt people.
I
I mean,
agree.
there's not too many other ways to slice that,
And
and
I think this is just like a broader conversation that maybe if like somebody is a health coach and they're listening to this, a lot of people don't know this, but the legal definitions of diagnosing and treating are actually reserved for physicians,
mm,
right? So if you look at like different state statutes as far as like what is a doctor, what are the privileges that a provider actually has, diagnosing and treating is what makes somebody the physician. So when you have people that are doing this as part of quote unquote health coaching, you do really set yourself up for possible legal ramifications, because now you can be held to the board standards of that provider, for example, right?
yeah,
So it becomes, this really tricky thing. And I think that, it's great that we have social media, we can share all this advice, and it's great that people want to get into helping other people about their health. But I do think that there really needs to be a more definitive line for safety purposes, so that people aren't getting hurt, because unfortunately, people are subject to what they're exposed to, and they will believe people that sound compelling. And sometimes they don't have the ability or the means to be able to discern whether or not this is correct information or not. And it might not be until they end up hurt or sick or something else that
yeah.
they, go down.
Oh, looks like we may have lost connection. Sabrina, can you hear me? Or have we lost you? I don't know. We'll give it another minute. Okay, so unfortunately, we lost our connection there with Dr. Solt, and weren't able to get it back going again. So I just wanted to say a very big thank you to Dr. Solt for coming on and speaking with me today. Hopefully, you guys found that helpful and useful. I certainly found it interesting myself, and please follow Dr. Solt on her Instagram, which is just DRSOLT, and her name is Dr. Sabrina Solt, SOLT. So thank you again to Dr. Solt, and thank you all for watching. I'll see you next time.